Wake up, 6 to 9 a.m.
Right, let's have a look at what's going on vaccine-wise. The numbers seem to have stabilized as far as new infections in the Western Cape go. Those numbers plateauing, but still we're looking at unacceptably high levels of infection. People are still dying, and there is a lot of chatter in the background around even the need to vaccinate. We'd made the point just a bit earlier. There seems to be enough supply of the vaccine floating in our province, but too little demand. On a daily basis, we get flooded with various vaccination sites sending messages to us saying, we've got space, people just need to come. They don't even need appointments. Can they please come on down? So this morning, I thought I'd reach out to, there's an organization or a group of people called the People's Vaccine Campaign. I've got Dr. Lydia Cairncross on the line with us now. Very good morning, doctor. Thanks so much for your time this morning on our breakfast.
Good morning, Aidan, and to the listeners as well.
Yeah, she's not only live on the radio, she's live on our social media platforms, so you can go along and watch this either in real time or if you have a gap a bit later, get to watch a conversation as it unfolds live. So initially, there were so many people who wanted shots in arms and there wasn't enough vaccine to float. Now we seem to have enough vaccine, but the queues aren't nearly as long as we thought they would be. What's going on, do you think, Doc?
I think it's a couple of factors. I think one of them is that there were a lot of people who were confident about the information around vaccines and were waiting for it to arrive. And I think those people have presented to the queues earlier. But now I think we are hitting a point where we need to do the active education work that's necessary to allow people to make an informed choice to go for the vaccine. And that requires work at many levels, the kind of work that you're doing here now on the radio station, but also community engagements, social media platforms, Department of Health interventions, so that we know that when people are coming to get the vaccine, they are making that choice with confidence and information. Why is this important? Right now, we are still experiencing the ravages really of the third wave, particularly here in the Western Cape. Even though the numbers have plateaued, our hospitals remain absolutely full with patients who are sick and dying of COVID-19. We are struggling as a health system to provide the quality of care that we would like to provide to every single person who presents at our doors. And I'm not sure if people have a sense of what happens when we have the peak of a wave. We have to stop a lot of the health services that happen routinely in the background that are really important. Things like surgery for cancer care, which is the kind of work I normally do outside of COVID, hypertension clinics, diabetes, HIV treatment, all of these things, maternal health, are being affected by the wave when it comes. And what does it look like? I've just come from a shift that ended at midnight last night. People come in gasping for air. And yes, it's the elderly, but there are also young people in their 30s and their 40s and their 50s. And many people we save and we manage to successfully treat them, but there are many that we cannot save. And the people that we are seeing are unvaccinated. Now, we know that there have been concerns about the vaccine, but we also know that there is a lot of very robust data and information out there from studies on the vaccines, particularly J&J and Pfizer. Tens of thousands of people were in those trials. And more importantly, millions and millions of people have received those vaccines. Over 350 million Americans have received the Pfizer vaccine and 4 billion citizens of the world have received the COVID vaccine. We know that these vaccines are safe and we know that they work. So if you look at what's happening in the UK, which is a real life example, they are having a third wave right now. In their second wave, they had a massive second wave and they had a huge number of deaths. The two waves followed one another. The graph of numbers went up and the graph of deaths went up. But they have vaccinated 50% of their population and those two graphs have now separated. The numbers have gone up very high, but the death graph remains low down at the bottom of the screen. I encourage anyone to have a look at that online and see on those websites what those graphs look like. We would love to see that in South Africa. We would love to not have a fourth wave here. We would love for our death graph to remain way down at the bottom. And as health workers, we are appealing for us all to step up and be vaccinated so that becomes possible.
Two things there, Dr. Cairncross. One is what's the word? As passionately and as academically as you've presented the facts and the information to me, we've engaged with health professionals who say the counter. They say that this is just a test vaccine. This thing still needs to stand the test of time from a clinical point of view, and they're providing alternatives. So that they're suggesting other medications and they're prescribing all sorts of things. I'm not going to go into brand names at the moment, but there's almost mixed messaging coming out of the healthcare sector, and perhaps that voice is from a smaller bunch of people, but it's equally as loud as yours. So that's issue number one. It's just like, which doctor do we believe? The other is loads of people say it's my choice. It's I have the right of choice to have this thing put into my arm, and I choose not to do that. And as health professionals, how do you counter that argument?
Okay, so I think I'll deal with the second one first. It is a choice. No one can force you to have a COVID-19 vaccine, but it is a choice that needs to be made with the right information and with the knowledge of what that choice might mean. I've had the COVID-19 vaccine. I've encouraged my parents and my family and my friends and everyone to take the vaccine. I don't personally know anyone who's become very sick after having the vaccine. I personally know friends and colleagues who've lost relatives to COVID-19 and have watched patients die from COVID-19 who have been unvaccinated. So it is a choice, but it's important that you weigh up the burden of that choice for yourself as an individual and also for those that are around you. I have heard relatives crying on the phone because they wish that they had had their loved one vaccinated, and they're only now realizing the importance of it. So some people, and I think it's a very small minority, are completely against the vaccine and have very particular views about why they are against it. But I think the majority of people who have not been vaccinated yet are just a bit hesitant. They haven't got enough information. The systems are not in place to make it easy for them to be vaccinated. And those are really the people that we are appealing to. If we can get a large number of people vaccinated, we can stop these waves of COVID-19 from really bringing our country and our health system to a grinding halt. About the mixed messaging from the medical profession, this is actually an extremely worrying situation that we have. Whenever a medical professional speaks, and I think that in recent days we've had a particularly bad example of this, that information needs to be evaluated against what is currently being put forward by the World Health Organization, by the National Department of Health, by our regulatory authorities. In other words, large bodies of professional organizations that have come together to look at the evidence. These are the people that we trust to make sure that the Panado that we buy in the pharmacy is actually paracetamol, and the antibiotics that we get are actually antibiotics. They are protecting us every day on a daily basis. Some of the medical professionals who may be saying things against COVID-19 or against the vaccine are not necessarily those that are working on the front line. When people are sick and they are gasping for air, they come to the hospitals, and the people that they are trusting here to treat them and their relatives when they are very sick, these are the same health professionals that are saying, please get vaccinated. We are the ones seeing it on the front line. And I think make sure that the person that you are looking and listening to has got that experience, and that what they're saying is grounded in reality. I think some of these health professionals have been in a bubble, have not walked the wards where people are sick and dying from COVID-19.
All right. There was a stat last week, Mitchell's Plain. I mean, if we're going to use that as an example, just to close our conversation, only 60,000 people in Mitchell's Plain had even registered for the vaccine, and the numbers differ, but I'm averaging it out there. About 1 million people who qualify out of that neighborhood and surrounding areas. It's a very low potential take-up rate, where one would imagine people would be stepping forward in much bigger numbers. So there still seems to be a lot more convincing to be done there, Dr. Cairncross, to get people to a point where they say, I'm prepared to take this vaccine. I understand what it is. I understand what it isn't. It isn't a cure, but it's a vaccine that that'll firstly prevent me from falling really ill as a result, and it's also aimed at preventing me from dying from this thing. It ups my chances of surviving both episodes. So these discussions need to happen with a lot more frequency, I'd imagine, for that dripping tap scenario, so that people understand that, right?
That's right. Aidan, I missed you there because I had a break in my reception. But I think the conversations need to happen on many levels. We're not here about forcing people to do things. We're here about building a partnership with people so that we can protect our health collectively. And that happens, yes, on platforms like this. But I've done a number of vaccine literacy workshops in communities, sitting with people. And when you sit with people in a circle with social distancing and masks, and we're as safe as we can be, and you have a conversation where you take seriously the concerns and you address them directly, that is how we begin to get a shift in consciousness. And that very quickly people move from I'm scared of the vaccine to, wow, how come I haven't been offered a vaccine in my community yet? How do I register? Why is it so difficult to register? And those kinds of interventions is what all of us need to start to be doing on a mass scale. So it's bringing people on board. It's not about forcing them, but it's making sure that there is a sufficient body of knowledge out there so that we can all protect one another and encourage vaccination across the board.
I'm going to thank you for your time this morning, Dr. Cairncross. I think you've done a fabulous job on behalf of the People's Vaccine Campaign. That's Dr. Lydia Cairncross. Just outlining why you should, and she's part of that frontline team that looks after people who are battling this virus. And she's saying, listen, she's had it. She's encouraged her family, her friends, everybody around it to have it. Is making the case then for you also to go out and get it. Brings us now to